Hello and welcome to Monday's Agenda. In today's program, we'll be talking about challenges and efforts in combating the spread of HIV in the country. My guest is United Nations Children's Fund, UNICEF Health Specialist, Joyce Mphaya. Welcome to the program.
Thank you very much.
Let's begin by talking about mother-to-child transmission of HIV. The numbers show an overall reduction, but still, Tanzania, according to statistics, is one of the highest rates of infection from, and this is a preventable occurrence. Why is this so? Or what is being done to reverse these trends?
Yeah, thank you very much for that question. Indeed, if you notice, Tanzania is one of the countries that is contributing highly to the burden of HIV, new HIV in children. And basically, if you look at Tanzania, our HIV rates are also quite high, where we have at least 6 in 100 people being HIV infected. And this is worse among women. So you will find that most of the women that are coming to antenatal clinic, when they are tested, you still find a lot of women that are HIV positive. The major challenge now has been, I think as a country, we've done quite a lot in terms of trying to make sure that we provide services to the pregnant women, services that are going to reduce transmission from the mother to the child. But we have a very big challenge in terms of the fact that you find that most of the mothers, they come alone to the health facilities for antenatal care. And then when you look at HIV, it's supposed to be a man and woman. And the key challenge has been we are able to test the women, we are able to identify the women that are HIV positive, and some of them are not able to access the treatment because they are scared of going to tell their husbands to say, I'm HIV positive, because some of them have faced consequences of divorce. So that has been one of the challenges in terms of accessing the services by the HIV positive mothers, and that is contributing to more transmission to the children. But on the other hand, also when we get the mothers that are HIV negative, it's not automatic that their husbands are also HIV negative. So you can identify the woman in the antenatal clinic that she's HIV negative. But then we are happy that she's HIV negative and should not transmit the virus to the baby. But on the other hand, it might be that the husband could be HIV positive while she's HIV negative. And in the process, she can get infected while she's already pregnant. So those numbers, you also find that there are mothers that are tested initially negative, but during the process of the pregnancy, they get infected. And those are the ones that transmit even quite high in terms of HIV from the mother to child. So there is a challenge in terms of men supporting their mothers, their wives or their partners to come and then being able to access the services together. But I think the other challenge is also, as much as you have scaled up the services to go out there to the mothers, we are not reaching all. There are some that are in hard-to-reach places. They don't have a health facility there. So despite that the services are available in the health facility, some mothers still don't come to the facility. So those ones are still not accessing the services at all. And on the other hand, we also have a challenge in Tanzania that you find that most of the at least a big number of mothers are not delivering in the health facility. Now, when it comes to HIV, you'd want mothers to come and deliver in the health facility if we were to try to stop transmission of the mother to child. So the mother can come to antenatal clinic, but then by the time they deliver, they don't come, and then the baby doesn't get the required treatment for prevention. So those are some of the things that are actually contributing to still more transmission from mother to child in Tanzania as one of the key challenges.
So how do you get male partners to engage in antenatal clinics and to be involved in the whole issue before birth and after birth? How do you sensitize men to do that? I mean,
I think it's a key thing that I think as a man, as a responsible husband, responsible partner, you know your wife or your partner is is pregnant first of all. You should be able to say it's both our responsibility. It's the man's responsibility, it's the woman's responsibility when there is pregnancy. But I think it's been there in Africa. It's not only in Tanzania. You find culturally in Africa, going to the antenatal clinic, it's been seen as a woman's place. Probably we have contributed it as the health system. Because if you go to the antenatal clinic, you find it's a group of pregnant women. Now, if this man decides to come with his wife, you feel like, oh, I'm not welcome. this is a woman's place. And you find that actually men take their wives to the antenatal clinic, but they stay in the car. Or else, if they come by the bicycle, they will park the bicycle under a tree and sit there and let the woman go to the antenatal clinic. So you still find men are already participating, but we've not involved them actively in the service delivery. And I think that's what we're trying to emphasize now, to say, first of all, let's make sure that men realize that when they come to the antenatal clinic, they also have to come together with their wives. But that requires us to be very sensitive to the fact that we've got men among women and that we shouldn't make them feel uncomfortable. So you'll find that in some of the health facilities, what they are doing now is if a woman comes with her partner, they are treated first so that the man can go back to the office. And that's one way of trying to encourage mothers to come with their partners to the facility. But of course, it might be something that people might argue, but I think we have seen it as working in terms of trying to bring men come forward with their wives. But also we've got programs like here in Tanzania, in Iringa, Makete, we've seen a very drastic change in terms of men going with their wives. You find that about 50% of the mothers to the antenatal clinics are coming with their husbands. Basically because we've used other men as champions. They go out there, talk to their fellow men to say it's good for us to go out and then be able to go with our wives to the antenatal clinic. So I think it's an issue of trying to use every avenue to reach men to realize that the pregnancy is the responsibility of both. The antenatal clinic, even during delivery, the man has a right to be there. And you can even actually claim to be there if you want to be there when your wife is giving birth. The only challenge is that in most of the facilities, and this now goes back to our health sector, we have to see how do we make our facilities male-friendly. Okay. Because if we continue the way we are, where you have just a group of women, or if the labor ward is just one big room with beds there, you wouldn't want a man to see another man's wife in the labor ward. So those are the areas that we try to see how do we make sure we do that so that at least we can encourage men to come. But it's key that men come with their wives to the antenatal, get tested together, and if the man is positive, the woman is negative, they are advised in terms of how they can proceed, in terms of to make sure they protect each other. But I think it should not be taken as an assumption, because you know the thing is that men have used the result of their wife as a proxy to say, okay, if she's negative, it means I'm also negative. If she's positive, I'm positive, but that's not the case. It's actually coming out clearly this time that over even 35% of people are having different results, and yet they are a couple. So we encourage men to really come forward and get tested and with their wives in the antenatal clinic.
But are they testing? Because you mentioned before the whole issue of stigmatization of people with HIV. Yeah. That's the problem. That's why they would rather not test. Not test.
Yeah. But surprisingly, if you look at among pregnant women themselves, most of them are accepting to be tested. So you find that the issue of stigma, yes, it's there, but I think now people have come to realize if they get through a thorough counseling process, they're able to understand the benefits of getting tested, especially if you are pregnant. So you find that a lot of mothers are accepting to be tested so that they know their status, because they're doing it for the sake of the baby to be born, as well as for their own sake to access treatment if it's necessary. For the men, I think it's still a challenge. We need to see how do we really motivate men to come forward and be tested. But I think it's also, we don't force people to come out in the open that they are HIV positive, no. So the issue of stigma doesn't really apply, because if the health workers find you HIV positive, it's an information between you and the health worker. You choose who you want to inform your HIV status. So you're trying as much as possible to avoid situations that are going to lead to stigma, and try to make sure that whatever is done, we try to motivate men to come forward. So I think the issue of stigma, people really this time need to really put it aside and try to look at yourself. What do you want to achieve in life? If your wife is HIV positive, she's pregnant, do you really want to risk the life of the child when you know there's something that can be done to have this child born HIV negative? So we need to weigh the benefits of whatever decision we make.
So there was a development of a product. It's a rapid testing kit. This is recently in the US, whereby results are attained in about 20 minutes or so, and you can do it. You don't have to go to a health facility. You can do this in the privacy of your home. Do you think such an equipment will be welcome to encourage testing?
If you look at rapid test kits, if you look at...
First of all, are they actually accurate? Are they...
It depends on the rapid test kit, because if you look at currently in Tanzania and all over the world, we are actually using rapid test kits for testing. And this is one of the things that has led to a lot of people being tested and getting results. Because initially what you do is you go to a testing site, they will take your blood and ask you to come back after a day or two to get your results. In the process, we're losing out on people. So the rapid test kits were developed, and then when they came, this is what we're using even in the antenatal clinic. You take my blood right now, we continue talking. Within 15 minutes, my results are out, and you tell the person the results right there. So with that, actually the test results, the test kits have been evaluated and they have been qualified by WHO that they are really giving the right results. With a very minimal, if there is any, but most of them, because when they come even in the country, they do what we call quality assurance to make sure that they are the right test kits. And even at the health facilities, they also do random quality assurance just to make sure that the test kits are actually okay. So basically, if you look at the rapid test kits that are being used in the facilities, they're used with blood. So that one, we are currently not encouraging people to do it at home. Because if you look at HIV, as you put it, there's the issue of stigma. One needs to go through a process of counseling so that they are ready for any result that comes. Now, if you have a person at home, they take the test themselves, and then they test themselves, and they find they're HIV positive, you're not sure how they're going to react. Others take it negatively, and then they can do something bad. So currently what we are trying to encourage is that every person should go be counseled, make a decision to be tested, get tested, and be told the results accompanied by the actual counseling and that is required. But on the other hand, if you look at the US, I think there are people that are developing now different types of tests. Some are using the saliva. I've not yet heard more in terms of what's the output, but I think we should be looking at the fact that the people that are doing that probably are already aware. It requires somebody to know exactly how you're going to deal with it, how you're going to deal with it if you're positive. Then they can be able to do that. But I think we have not really brought it forward for us to be able to start using the saliva or testing that could be done at home, probably in the future. But I think now, because of stigma, information levels are not quite high in some of the populations. We need to make sure that we protect the people.
Transmission rates in Tanzania seem to differ from place to place. You have the Lake Zone region whereby the rates seem to be higher. You mentioned Iringa. At some point it was Mara, Iringa and Mara regions. Why is the difference? What needs to be done to ensure focus is in those areas where it seems to be have higher rates?
Yeah. I think that's quite true. There's a geographical difference in terms of the HIV prevalence in Tanzania, and it's almost the same in several countries. There are some various contributing factors to HIV rates transmission. You find that in some of the places, basically, it's because of their practices. In some places, they have like concurrent multiple partnership is not a big deal. There's a lot of people having so many partners, having sex with so many partners and then not using protection. And for them, it's okay to have multiple partners. And those places, you find that it's quite high. Iringa, one of the reasons has been, if you look at Iringa, it's a transit point. People from Malawi are passing through Iringa, and then they normally you'll find they sleep probably in Iringa. So there's a lot of people traveling from Malawi, from other countries, and they converge in Iringa. They may find that the men, probably the truck drivers, they're sleeping with the same women. And these same women also have men within Iringa that they also go out with. So there's that also in terms of one of the contributing factors being that. But in other cases also it's like, it's a hot spot for business. So you have a lot of people coming for business. Some women want to make money out of that. And then they have also their own partners. Then it goes round like that. So the issue, that's the other contributing factor. But I think one thing also we need to know is the knowledge levels, probably. Knowledge has been spread differently to different places. So probably by the time the others are getting the knowledge in terms of how do you protect this, first of all, there's HIV. Then you have to protect yourself. It might have taken long for people in other places to get that knowledge, and even just not just that knowledge, to know that they can protect themselves using condoms and being able to get that condom and use it with the cultural issues, with issues of myths that go around with condoms. You still find people were vulnerable. So you find that in other places, cultural practices, there are some cultural practices that actually also contribute to transmission of the virus, like wife inheritance and all those. I don't know, probably there are some parts in Tanzania that's happening, but also some practices where it involves like blood, exchange of blood, like using the same razor blade to put tattoos. In other cases where you have probably traditional male circumcision, there are some that are not doing it safely. You can also transmit the virus from one person to the other. So I think those are some of the contributing factors.
New HIV infections seem to be highest among young people in Tanzania. What is being done to focus on this group of people?
Yeah, I think the data shows that new infections are quite high in adolescents and young people. Basically, I think as I have put it, when HIV came, it became like something that you're not supposed to talk about. So we eventually targeted adults, and people are saying, children, don't target them, don't tell them this information. Then these children are growing up to become young adults, adolescents. And then in that case, you find that they are growing up without adequate information to say they should be able to protect themselves. And I know we are saying we are a religious country. The religion promotes that people should be able to abstain. But I think with exposure to the globalization and all this, you find that children of today, they are starting to have sex very early. And unfortunately, you find that most of the girls, they're having sex with older men who have already been exposed. So you find that most of the times the girls are the ones that have got very higher HIV rates compared to their fellow boys. But basically because they start having sex with older men than they do, in some cases because they want money, some cases because they are like sexually abused. So in the process, you find that a lot of girls are getting infected. On the other hand, they, as much as they're going out with the older men, they also have their fellow boys that they go out with. So you're seeing transmission, intergenerational transmission from adults to the girls and the girls to the boys, and then it goes around young people. So basically, the other thing has been the fact that I think we've not made it clearly in terms of young people accessing the services that are going to protect them from HIV. Because I think we've always condemned that a young person should not use condoms and all that. But I think reality on the ground is the fact that young people are having sex. We literally see it in terms of teenage pregnancies. It just shows you clearly that sex is going on. So I think what we need to do is how do we make sure that we protect these adolescents? And that's one of the areas as UNICEF we are trying to focus on to make sure that young people, adolescents, they start getting knowledge at an early age. Even in school, they should start getting information on HIV. How can you protect information that is relevant to their age as they grow? So by the time they become adolescents, they exactly know what it means. If you have sex, you can have this. Now, if I really want to decide to have sex, I should do it this way so that I am safe. So I think that's an area we're focusing in terms of trying to make sure that we support the government of Tanzania to have like what we call life skills education in school, where HIV is also part of it. Sort of like, will it be part of an existing subject or a totally new subject? It's a subject called life skills. It's not only on HIV. There are several life skills. What we want to say is that we want this young child to be empowered. She should be empowered to know that this is a decision I want to make, this is what I want to achieve, and then some of the decisions will be related to HIV. So if you can get the children as they are young, getting that information through the schools, at the same time, out of school young people are also targeted, it will be good for us to see how we can work with young people and reduce the virus. Only last week, retired President Ali Hassan Mwinyi called for behavioral change in order to combat the spread of HIV. Behavioral change, how easy or how difficult is that in the context of African culture? Yeah. I think behavioral change is a very complex issue. When we talk about it, we think it's just a simple thing. But it requires somebody to be able to, first of all, get the information. What behavior do you want them to change? This person should be able to understand why it is important for them to change. They should see a benefit, that if I change, this is the benefit I'm going to get. It's only when they appreciate the benefit that people change their behavior. But if they do not see the benefit, they don't change. So when it comes to HIV, we really need to pass the information in such a way that people should be able to realize that if I do this, this is how I'll benefit. And then the benefit is you remain HIV negative. But I think we are also passing our information that it doesn't even also, it's not the end of life if you're HIV positive. Now with treatment, people are on treatment and can live long. So even behavior changes both for both HIV positive, both HIV negative, so that all of them, if they look at life, they have to look at life positively, appreciate the benefits of taking interventions that are being proposed, and being able to live a life in a positive way. So my message is, I think behavioral change is key to reduction of HIV, but I think we need to provide the right information coupled with the right services that they require. Because sometimes we provide information to say, protect yourself, protect yourself. Now this person wants a condom, they can't find it anywhere. What are we doing? So we have to make sure that when we are telling people to change behavior, we also equip them with the right skills and the right services that they require for them to change their behavior.
Lastly, I want to talk about funding, because all these health projects, sensitization and mother and child health services, they all require money.
Yeah.
And there has been a reduction in aid from developed countries. What kind of impact will this have on projects in the health sector in Tanzania and in developing countries?
Yeah, I think it's a global problem, the economic crisis, and I think generally it has generally affected the HIV sector globally in terms of funding. I think you can already see Global Fund, the way they are reducing their funding to countries. So basically this global crisis has affected the HIV/AIDS program globally, and Tanzania is one of them that is not going to be spared. And I think it's time we sat down and seriously looked at ourselves to say, in case, we should always work at, in case we don't get any donor funding, do we want to lose all the effort we have put? Do we want to let people who are on treatment now have no access to treatment, or do we want to stop our prevention interventions? I think it comes back to us as Tanzanians to say, and Tanzanian government to say, what can we do on our own? Okay. We have resources internally, we have private sector, we have government. I think it's time we all held hands together, try to come up with our own way of funding our programs, and then if funding comes, it just complements our own efforts. But I think domestic financing is key at this point to HIV programs. Looking at the trends, you have overall reduction, but also increase in infection rates. What's your message as UNICEF regarding HIV and AIDS? I think my key message, which is a global message, is that it is possible to have zero new infections. Starting from children, we can have children born without HIV, we can have adolescents not getting new HIV infections. So I think the message is positive that we will be able to achieve elimination of HIV, especially in children and in adolescents, if we all put together. So let's all focus on trying to make sure that how do we ensure that we protect our children, we protect our adolescents, and we protect the parents, so that we are all there. We have a new generation that is HIV-free, and parents that are there to take care of their children.
Earlier, I caught up with Regional UNICEF Goodwill Ambassador Oliver Mtukudzi, and we talked about his work with children living with HIV and AIDS. Let's begin by talking about your work as United Nations UNICEF Goodwill Ambassador. What does that involve?
What does that involve? Well, really, it involves the children. It involves, I'm responsible of HIV and the youth. It involves a lot of traveling, since the regions are huge, eastern and southern is quite a huge region. So it involves traveling, it involves participation in the fields with with the projects that's going on under UNICEF.
Okay, you've been a Goodwill Ambassador for about a year now. You are back in Tanzania, this time in the capacity as Goodwill Ambassador. So what brings you here? What's your mission here? What have you seen?
Well, my main mission really is my first time visiting Tanzania as a Goodwill Ambassador. My mission right now is to understand what the UNICEF Office of Tanzania is doing.
It seems that south of the Sahara, the infection rates are the highest in the world. Why do you think this is? Do you think it's because of some attribute it to the culture, the African culture of multi-partners?
Well, there's a lot of reasons why. I mean, at times it's illiteracy, it's the cultural laws, at times it's lack of information, you know, but it doesn't make us any worse than the rest of the world. No, I don't believe that.
And what about kids that are affected by the effects of HIV/AIDS, where you have parents of kids both deceased, and they're left on their own to take care of themselves, really? What kind of support do you think they can get? I mean, is it government? Is it government's responsibility?
They need maximum responsibility. I mean, those children are everybody's responsibility. Governments and communities and so on. We are all responsible for that, because AIDS is not a partisan disease. It's a disease for all, and you might not be infected, but you are affected somehow. And like in Zimbabwe, I've dealt with about 200 kids who are actually running families. Some of them are at the tender age of 7, 8, running the whole family because parents are gone. And to answer your question, all of us has to do something about it, because at the end of the day, it will affect everybody.
When you advocate for the rights of children, do you see that the African culture in some way does not give priority to the voice of children? How is it when you agree?
Well, really, I'm not against cultural laws. They meant well. They're very perfect. But it's because of greedy people who twist these laws to suit themselves. And by so doing, they end up abusing women, abusing children, you know, in the name of the cultural law. And at the end of the day, the picture that comes out is like those laws were useless. But no, they meant well. If they're taken in the right concept, they mean well. And because there's no cultural law in the whole of Africa that say a woman is secondary. All laws mean wives are the backbone of the family. But people twist it now and say no.
What about the culture of polygamy, whereby one man? This is African culture.
Yes.
Even my grandfather here, you know, they have more than one wife. Is this?
It wasn't a law. You know that? It wasn't a law.
Okay.
It's an individual decision. It wasn't a law at all. No law said have so many wives. No. No cultural law said that. It's a decision of an individual.
But acceptable, decision that's acceptable in society.
I wouldn't say it's acceptable, because all those women always complain. It's not acceptable. But it's one's decision to do that.
Okay.
And we are saying we can't carry on with that, such decisions, because with the deadly disease right now, it means we're giving more avenues for the spread of the disease.
One of the ways that people see that in order to free, especially children, vulnerable children, is to empower them economically, so they can, you know, they can look after themselves. Maybe some projects, so they can fund for education instead of going into things like crime or unacceptable behavior. Maybe initiatives or projects to make sure that.
Well, Yes, I think that would work well for the children, really. It would work well for them. But it doesn't mean if you give them money, they're not going to be criminals. Do you know crime is done by people who already have everything? But they're criminals. The idea is to make sure these children grow up as responsible, and they grow up as decent citizens of the country. You see? If you do that, then you're empowering them even more, because as they grow up, they're acceptable in the society because they're good boys, they're good girls. And if we ignore teaching them how to live and survive, then we're not doing anything at all.
Let's talk a little about your music. I mean, you're one of the few people who has a beat named after them, the Tuku music. What is your inspiration for your music? Where do you get your inspiration?
Well, I was the last person to know the music that is called Tuku music. I didn't create my music to be Tuku music, but my fans really labeled it that way. But all the inspiration comes from the people, the way we live, personal experiences and so on.
Do you use your music, your gift as a musician, in order to advocate for these issues, that your work that you do, AIDS and protection of children's rights?
Well, purpose of song, or should I say purpose of art, that's all disciplines of art, sculptors, dancers, poeters, you journalists, you're all artists. The purpose of us is to give life and hope to the people and to heal the broken hearts. So, to answer your question, music, that's the purpose of music.
And today, what's your view of hip-hop music today, of the image of hip-hop music?
I like hip-hop.
Okay.
Because it's something that I like.
Okay.
But it's not something I can do.
Okay.
Because I have to be Oliver Mtukudzi.
Okay.
I have to be proud of who I am.
Okay.
Hip-hop music is not bad. But it's no better than my African music.
Do you think that's important to have to create something distinct and individual in any art, as you say, whether it's culture?
Well, what happens with art is you're gifted. I'm not talking about artists by education. I'm talking about artists by talent. You know, those who don't even go to school to do it, they just do it. We are so unique. That's why we don't have competition. We are just unique.
There's no other Tuku music.
No. Somebody, my own son, my late son, did Tuku music, but it wasn't the Tuku music I do. He had his own Tuku music I can't even do. You see, so we are just unique.
I want to talk a little bit about intellectual property rights. This is works of musicians being used by other people, and some of them actually making money out of that. This happens.
Not some of them, all of them.
All of them. They make a lot of money out of that.
Yes.
A huge problem in Africa, mind you. To buy an album.
It's not. Sorry. It's not even an African problem. It's a global problem.
A worldwide problem. But particularly because, I mean, if you're in the UK or in America, you know, to buy an album, maybe you can afford it. But in Africa, to buy an album that, you know, for, I don't know, $15, one album, and as an alternative, you can easily download this free on maybe the internet, or get it from another source and copy it. How serious is this problem for African musicians? In your own experience, have you had?
Of course, all artists are suffering. Piracy is just a killer, and I think it's lack of respect towards artists doing that, because it takes so much to come up with that particular art, and somebody just rips it off, and it's lack of respect. And I think it's a matter of educating the people, because we can't stop doing it. And if we stop doing it, they don't have life. You see? But they should at least respect artists and pay what's due for due.
What about the laws? Do you think the laws should, step up in order to protect the rights of works of artists?
Yes, I mean, we can't just sit and keep quiet. And I think laws we should have laws that really make an impact to those who don't respect artists.
Of course, and when you're talking about laws, you have to talk about enforcement of those laws, because there's one thing having the laws on paper,
and then enforcing
and enforcing, especially on the African continent, where you have a lot of priorities out there, and to ensure that somebody in some village is listening to music, Oliver Mtukudzi's original music, and hasn't downloaded is not an easy thing.
It's not an easy thing. I mean, it's development. Okay, development is okay, but in most cases, development means losing certain qualities. And if I remember when we were doing vinyls, no one would copy that. You had to buy a copy of vinyl because you can't duplicate it. You can't, So it was better then, but we had to develop into CDs, into cassettes, CDs, now MP3s and so on. You see, and we lost that quality that we could do, which was very protective to artists.
Okay. Musically now, what are you doing? Are you working on any projects?
Yeah, I'm working on a lot of things. I have a production called Masanga Bodo, which means no coincidence at all. For us to be artists, for a Tanzanian to be a Tanzanian, it's no coincidence at all. It was meant to be. I'm doing that. I'll be performing that production on the 22nd of June.
You seem to believe that in destiny rather than self-determination. Is that correct? You believe that whatever somebody does, if something is destined to be, then that's how it's going to be?
Well, it is. There's the truth about it. But of course, whatever destiny you have, there's obstacles you have to take care of. If it was meant to be, it might be too late for you, but it will always happen, whatever time.
You had, the last time you were here, or some time back, you did a collaboration with Tanzanian artist, Lady JD.
Yeah.
Are you thinking of any more collaborations and different?
Well, collaborations are very healthy for artists and of course our fans. If you do a collaboration, you learn a lot from your fellow artists. Likewise, she did on mine, and yes, I can do more collaborations.
Okay. I want to talk a little bit about your view of African music today. Do you think that its message, is there a message in Africa? Is there something like African music, or is music today a mixture of
there is African music. There is African music. The world out there is looking for Tanzanian music, and Tanzanian music can only be done by a Tanzanian, because there's no better Tanzanian than a Tanzanian. So there is, we have our music, we do have, but it's the problem is maybe we're looking down upon who we are, and trying to be like so and so. So what most of youngsters in Africa are doing right now, they'll always be like 50 Cent, like R. Kelly, like Beyonce, So if you're like Beyonce, where is you?
Right. I was going to talk about sampling. That brings me to the question of sampling. What is your view of sampling? Taking beats from another. Do you think that erodes creativity?
No, I think it's piracy. People have sampled my music. What is this called? Magoo and them. They've sampled my music, but it doesn't make my song better. If you're doing a cover version, you have to do it better than the original one. But sampling doesn't do that. It actually gets spoiled because they add a lot of things into your song. Probably they'll take your voice and do something on top of it. Then it's like dirt on my song.
Okay. I want to come back a little bit and talk about Tanzania and your being here. Now that you've seen, you've visited projects done by UNICEF, what's your next move? Are you going back to Zimbabwe, or?
Well, I'm going back to Zimbabwe, and my next visit as an ambassador is in Mozambique. Yeah.
Well, and what's your view about Tanzania?
Well, Tanzania is home, but maybe I should talk about mothers and PMTCT, that there's no child, we're not going to have any more children born with HIV, because the services are there in the country to protect the disease from the mother to the child. So I think this should we should let people know and understand that they should do it, and they should come and get tested with their partners, make sure we have a HIV-free generation. It's possible.
But do you think people are responding? Do you think the stigmatization that goes with people with HIV has been eradicated in Africa?
No, it hasn't been eradicated, though. But they need to be educated. They need to know that there's life after being HIV positive. They can actually have a HIV-free child. They can even, the services are there already right now.
Okay, on that note, I'm afraid we'll have to leave it there. I'd like to thank my guests, United Nations Children's Fund, UNICEF Regional Goodwill Ambassador for Eastern and Southern Africa, Oliver Mtukudzi. Join me same time, same place for more of The Agenda.